Good morning, everyone. Today, our topic of discussion is neurological investigations. And now, of course, there is a lot of overlap, in investigations. For example, if we will talk about neurology, there are many conditions in neurology like stroke, for example, like hemorrhage, like multiple sclerosis, or many conditions right up there. So it doesn't mean like in neurological investigations we are going to discuss the CT scan of the brain, or for example, we are going to discuss the biopsy. Of course, we do use those investigation methods in neurology, but the point here is, of course, for example, CT scan or X-rays we are going to discuss in imaging, right? So I will be talking about the investigations which are purely related with neurological conditions, and they are not part, or they will not be discussed in any other section. Okay, like CT scans or MRIs we are going to discuss separately in imaging part. So uh, basically what we I'm going to discuss in this section is about um, CSF analysis. I'm going to discuss about um, other neurology investigations like nerve conduction studies, electromyography, and electroencephalogram, things like this. So let's start our discussion with CSF, cerebrospinal fluid analysis. So, as we know, what is CSF, cerebrospinal fluid? It is the one which is circulating around the brain, around the spinal cord, and simply um, to talk more about this one, simply this one CSF, how we take is like we do a lumbar puncture. And what is lumbar puncture? You can see over here how they perform lumbar puncture. Um, of course, like this is a part of procedures, right? But I'm just telling you over here, um, like in the sitting position or in the laying position, what they do, they pass a needle um, inside the subarachnoid space where the CSF is flowing, and they take it, right? So basically this needle is passed in the third and the fourth vertebra. Okay, because this is the spinal cord, it terminates around L1 level, and that's the reason when we take it around L3 L4 level, there is no chances that we are going to you can say damage the spinal cord. So simply now CSF can be obtained by lumbar puncture, and we can provide a number of testings on that CSF. For example, we can check the pressure, we can check the appearance, um, we can check either there is how many proteins are there, how much glucose is there, what is the gram staining we can perform to catch different organisms. We can check the ratio of glucose in the CSF as well as with the serum, and we can check the white blood cells or white cell count, and we can do other tests as well. We can also do microscopy uh, for this one. So now, of course, like here you can see this one, normal, how it appears, and bacterial, viral, or TB. Like for example, someone have bacterial meningitis, someone have viral meningitis, and not just these conditions, by the way. We can also uh, can do lumbar puncture to see like what is the pressure, to find out intracranial hypertension. We can also do this thing to as a diagnostic, or you can say as a help to get the diagnosis of multiple sclerosis. So multiple things can be seen. So I show you like how they do lumbar puncture, and of course, like when you are going to, yeah, what you can say, study about different conditions, when you will be going to the procedure part, and you will be learning about how they perform, like what are the steps in performing lumbar puncture. So sometimes this lumbar puncture is also done for therapeutic reasons. Simply, uh, you can say just to see, um, just to relieve the pressure of, or just drain the CSF. So simply, once they pass the needle inside that space, they can measure the pressure. So once the needle have passed and the CSF started draining, so they can connect it with a manometer, okay, and they can measure the opening pressure. We call it as opening pressure. Okay, what was the pressure of um, CSF? Okay, at the time we pricked it. So now this opening pressure is only meaningful if the patient is in lateral decubitus position, or what you can say like this position, to be very exact, this position, right? So this is called as lateral decubitus position. Simply the patient is lying on their side. So at the time of puncture, of course, right? So uh, of course, like what's the reason behind this thing? If the patient is sitting, for example, if the patient is in this position, not in this position like the lying, but the sitting position, of course, the pressure will be increased because there will be more pressure coming here. So that's why I remember, like we always check the uh, pressure in this position, lateral decubitus position, or you can say when the patient is lying on their side. Okay, so now normal values you can see over here. Okay, now this one, many books they give it in millimeter of mercury. Many books have different values, but you can remember it like this. 5 to 20 centimeter of water. Okay, is like the normal pressure, and you can see like whenever there is bacterial meningitis, it is increased. Okay, so uh, like the CSF pressure can be increased in multiple conditions. For example, um, opening pressure of CSF, right? So we are discussing this thing. So it could be increased in multiple conditions like meningitis, as well as tumors, okay, as well as intracranial hemorrhage, and there's a condition called as idiopathic intracranial hypertension, or it is also called as benign intracranial hypertension. Okay, so benign intracranial hypertension. So in this one, like that will be raised as well. So what happens, like basically we don't found any cause, but still the intracranial pressure is raised. So that is called as benign intracranial hypertension. And it could be decreased in number of the conditions, like for example, um, if someone have CSF leak, okay, like the CSF is leaking, so of course the pressure will not be built up like what normally is. Also, like if you have performed, um, you can say repeated CSFs, right? So you can say a recent lumbar puncture. Okay, of course, like it is going to, the pressure will be decreased in this case. Okay, then you can see over here uh, appearance, right? Now, uh, what you can say, Normally, uh, like the CSF is clear. Okay, it's a clear fluid. So, but in reality, it is not that much clear like water, you can say. But of course, like for that, you have to see multiple CSF samples, which are normal. But you can say like the CSF is clear. Okay, but it could be like turbid in meningitis. It could be like fibrin web in the case of fungal infection or TB. And one of the thing, it could be bloody. The appearance could be red color. For example, in subarachnoid hemorrhage or traumatic tap. Traumatic tap, like when you, while doing that lumbar puncture, if you have punctured some vessel, so of course, like the CSF will be bloody color. So, uh, um, what will happen, that the operators, when they're performing the lumbar puncture, like even they don't know, like they had hit a blood vessel. Okay, so now, um, one thing, by the way, um, to check, like either it's a traumatic tap, we call it as traumatic tap, like if the um, like the performer or the examiner, when who is doing lumbar puncture, if he had hit the blood vessel, what they do, they keep on collecting the CSF samples in three different tubes. Okay, so if in the both the three samples, if the amount of blood is same, it means like all the CSF is full of blood, so it could, like, there is less chances it is a traumatic tap. But if, like, as compared to one, like, then you take the second and then you take the third one, if in the third one, the blood amount is come, or it is less, like less, or it is less blood stain, so it means like it is due to traumatic tap. So this is like what they do in this one. uh, One thing, for example, in some subarachnoid hemorrhage, of course, like when there is hemorrhage in the subarachnoid space, so what happens is uh, there is a thing called as xanthochromia, XANTHO, xanthochromia. So, like, xanthochromia presence means that, it is some sort of hemorrhage. Okay, so that is one of the things which we can do. Then, of course, we can go for microscopy, and in microscopy, of course, microscopy is done to see what kind of cells are there and how many cells are there. Okay, so what is there, like in microscopy, of course, like they take the CSF, they see it under the microscope, and they measure like how many white blood cells are there, how many red blood cells are there. Okay, so this thing can be done. So now you can see, like when they see the white blood cells in microscopy, so you can see, like, normally it is less than three cells per millimeter of cube. Okay, but if the cells are more than five, okay, it suggests central nervous system infection, could be meningitis, could be encephalitis. But it could be found in other inflammatory conditions like cancers, like any other inflammatory condition. So simply, and they see like what kind of cells are there. For example, they can see either it's neutrophils, which shows bacterial infection. They can see either it's monocytes, right, which can point towards viral infections. Okay, or fungal or TB infection as well. So remember, guys, whenever there is a bacterial infection, what they have is polymorpho neutrophils, and whenever it is a viral infection, so they may have monocytes. Okay, so this is one of the thing they can do. So microscopy can be done simply, and after that, You can see we can run the gram staining on the CSF as well. So now, like we have already discussed about gram staining in the previous lecture. So simply why we run the gram staining to catch what kind of organism is there. Of course, uh, normally there is no organisms. It will be positive in bacterial infections. It will be normal in viral infections, and in TB especially, you have to use some special stains like Zeal's Nielsen staining, which we use for tuberculosis, right, or Mycobacterium tuberculosis. Nowadays, of course, like not just this, rather they have multiple testings available. Like uh, they can run the test for um, what you can say PCR. They can run, okay, polymerase chain reaction, and like PCR can catch different viruses, different bacterias. Okay, so PCR can be run nowadays, of course. So uh, now a very important thing, we can take a sample, we can send it to the lab, we can go for the gram staining, we can do for the go for the sensitivity, and that will decide what kind of antimicrobial therapy you have to give to that patient. For example, if it's what kind of bacteria is there, they are going to find this thing, right? So also, like you can do some serological tests like for unusual organisms like syphilis, like HIV, and all this stuff. So one more thing is the protein levels you can see over here. Like normally the CSF have 0.18 to 0.45 of gram per liter. You can see gram per liter of proteins, right? Um, Present in the CSF. So now, uh, why this thing is important, by the way, why we do check the proteins. Uh, Whenever the protein levels are elevated, so of course, like it point towards some pathological process. For example, you can see over here that in meningitis, the bacterial one, the proteins get raised. Okay. There are many other conditions in which the proteins can get raised. For example, in brain abscess, for example, when there is some hemorrhage, for example, there is a condition called as Guillain-Barré syndrome or multiple sclerosis, the proteins are raised. Okay, so you can say uh, that causes of raised um, CSF proteins, right? So, what could be there? It could be meningitis, it could be brain abscess, it could be intracerebral hemorrhage, it could be neoplastic conditions, okay, or neoplastic diseases, it could be Guillain Barre syndrome, okay, it could be multiple sclerosis, okay. So all these things can be raised. Rest you can see over here, we can measure the glucose level as well, and uh, again, why we do this glucose measurement, you can see uh, like glucose, by the way, is always check with reference to the serum glucose, because whenever the serum glucose will increase, what will happen, the glucose in the CSF will also increase. So of course, like a blood sample of glucose should be taken with a CSF sample, and then we interpret this one. So always this glucose level is seen with reference to the serum level, right? So basically, normally, what is there is like the CSF glucose should be around, you can say, around 60% of what is present in the blood. And that's why you can see the ratio of glucose of CSF ratio to serum is around 0.6. Or you can say, for example, if there is 100 gram of glucose is present, milligram of glucose is present in the serum, so in the CSF it should be 60, right? So that's why it is written 0.6. Okay. So you can see over here uh, that whenever someone have hyperglycemia, of course, this level will be increased, right? So if we will just see this level, so we can, it can mislead us. So or we always see like either there is hyperglycemia with CSF increased glucose, or like without any reason. Now whenever, okay, one more thing is important is like now we know like when the in the serum the glucose level is increased, so this value will be increased as well, right? So for example in diabetes, so now whenever the glucose is low, for example you can see this one. Now this one or this one, see the glucose level is decreased, right? So whenever like this is the case, when, or you can say when the glucose level is decreased in the CSF, this one point towards something, a bacterial infection or a fungal infection, things like this, right? Or a tuberculosis infection. So remember guys, in the case of bacterial, fungal or tuberculosis infection, the level of glucose in the CSF will be decreased. So this is important, but right, you can see like the viruses, they don't cause any problem with the glucose level of the CSF. So like this way, like we have discussed all these things, but of course like not just these things, like when you have CSF, like you can perform a lot of tests on the blood, so simply you can do a lot of tests on CSF as well. uh, Now I talk about something called as Zentochromia, right? So I think like I must explain this thing a little more so that you must have a good idea what is Zentochromia. So what is Zentochromia? Zentochromia literally means chromia is color, Zentho, so it is like simply yellowish or uh, yellow discoloration. Okay, so whenever the CSF is yellowish color, we call it as Zentochromia. Okay, so now how they see this thing, they basically they use a technique called as spectrophotometry. So what is spectrophotometry? Like simply when they run it over this, okay, and it come back as positive, so what it means like that it shows that there is bilirubin is present in the CSF. Now for example, if someone have jaundice, okay, so in jaundice when you will check their CSF, what you will found is bilirubin. Okay, so like this thing concept is easy, right? Now for example, the person don't have jaundice, this xanthochromia is most often is checked for a very serious condition called a subarachnoid hemorrhage. Okay, now when you will study in medicine hemorrhage, HG, okay, you are going to this subarachnoid hemorrhage in surgery, by the way. So what happens in subarachnoid hemorrhage? Basically, there is a hemorrhage in subarachnoid space. So the CSF basically contains blood. Now, guys, from where the bilirubin comes from? The bilirubin comes from the breakdown of the RBCs. Okay, so simply uh, in subarachnoid hemorrhage, you can see um, xanthochromia is a very useful finding because like of course like it will show that the patient have subarachnoid hemorrhage, right? So simply when they have like the blood is going to leak in the subarachnoid space, xanthochromia will appear in the CSF. So from why the Zentochromia is there? Because there is bleeding in the subarachnoid space, and bleeding means what? RBCs, and RBCs will be broken down, and they are going to release bilirubin. So basically, what we do in reality is like first of all we perform a CT scan of the head, okay, just to rule out any increased intracranial pressure. So when the CT scanning comes back as normal, then we go for lumbar puncture when we are suspecting anyone with subarachnoid hemorrhage. The people, they present with too much pain or the worst headache of their life. This is how they present. So this is what is done, by the way. And it's not like this that someone who has subarachnoid hemorrhage, they will be having the presence of Zentochromia immediately. Rather, it takes some time to develop. Why? Because see, the RBCs are going to broken down, and then of course they are going to release bilirubin. So you can say uh, to appreciate Zentochromia, we have to wait at least uh, at least 12 hours, okay, after after the onset of symptoms. Okay, so this is very important. Okay, so like of course, like this much time should be passed simply so that the blood in the CSF should be broken down, and bilirubin will be released, and of course like the bilirubin, when it will be released, so we will see Zentochromia. So one thing is that one, and one thing I already told you that the presence of Zentochromia is, or in a sample, is or can be helpful in distinguishing uh, blood blood-stained CSF from traumatic tab, right? So simply when Zentochromia is present, so of course it is subarachnoid hemorrhage. When there is no Zentochromia, it's a traumatic tab. Like during doing lumbar puncture, you have punctured some of the blood vessel. Why? Because if it's a traumatic tab, of course it takes 12 hours for the blood to be broken down and Zentochromia to be present, right? So a very important test to distinguish between these two. So this is like in this case, in traumatic tab, of course Zentochromia will be negative. In subarachnoid hemorrhage after 12 hours, Zentochromia will be positive. In jaundice, of course Zentochromia will be positive. So this is the important things which we can do. Now, one last thing before going to discuss on the other things is one more concept called as oligoclonal bands. Okay. Now, what is these? Basically, again, maybe you won't understand this thing completely now, but I will just tell you that you know like our serum, blood, or our CSF have some proteins, and what we do, for example, if we are going to put those proteins in a medium, okay, and then we pass current, for example. So what happens? Uh, Proteins are negatively charged, right? So what happens? The smaller proteins, they will travel faster towards the positive one, and the bigger proteins, they will travel less. So this is called as electrophoresis. What I'm talking about is electrophoresis, right? So basically you can see these bands, you can see the bands, this one, this one, this one, this one. These are basically bands of proteins, right? So simply in certain conditions like multiple sclerosis, there are some of the proteins are increased in the CSF. So what we do, like when we pass a current, through that CSF, we get some of the bands which are abnormal, which are not present in normal CSF. So again, like um, these oligoclonal bands are not diagnostic for multiple sclerosis, but they can, you can say they they are one of the finding in multiple sclerosis, so they can help in making diagnosis of multiple sclerosis, right? So this is called as oligoclonal bands. As I told you, not just these, like there are many other tests which we can do on the CSF, like we can go for cytological examinations, like uh, what you can say, we can check for cells, abnormal cells. So we can do a cytology, we can see abnormal cells. For example, in the case of malignancies, we can see that. So all those things. So of course, like we can do these tests as well on the CSF, right? So like these are the basics, guys. Simply, these are the basics which I wanted to tell you. Of course, like nowadays there is a lot of you know, investigations are there, right? So but like these are the basics, bare minimum, which the medical student should know. Okay. Now, one of the thing which I wanted to tell you or talk about is something called as um, neurophysiological investigation. So, neurophysiological investigations. Now, what is neurophysiological investigations? Uh, Now, one important thing is like even when you will study neurology um, in your final years, maybe they will not teach you all this investigation in detail, but they will do introduce you like how this investigations work. Why? Because they are basically what we say as a specialist domain. Like there are people who specialize in this thing, how to conduct these studies. So uh, you can see like at your level or undergraduate level, a little introduction is like more than enough for you guys. Okay, like you must have an idea what are they. What is these neurophysiological studies, by the way? So there are many like of them. We will discuss few of them. Like one is called as nerve conduction studies. Okay, so nerve conduction studies are also called as NCS. Of course, like this is the abbreviation of nerve conduction studies. Other than that, there is electromyography. Electromyography. Okay. Then there is visual or visually evoked potentials. Okay, potentials, or you can say responses. Both are correct. Okay. Sorry, there is spelling mistake with potentials. Okay. And there is, I think all of you know what is electroencephalogram, right? Or graphy, simply. Electroencephalography or electroencephalogram. So these are the neurophysiological studies which we can do in the patients now. The first thing which I want to show you, like this is called as NCS or nerve conduction studies. So now, of course, like they are doing the study, the results they give in the form of graphs, okay, or table form. So simply what they are checking over here is like how well the nerve can transmit the electrical signal. So see, in this case, this is the median nerve, by the way. So they are checking the median nerve. Like if you know how the nerve works, what muscles median nerve supply. So the median nerve basically pass from here, and it gives something called as carpal tunnel syndrome. So anyhow, that's a clinical side, but this is right now their nerve of interest. So see, they are stimulating this nerve. See, this is negative positive. So this is the electrode they put on that nerve, and they are stimulating this nerve. And now this nerve stimulation, of course, like this nerve will send the electrical stimulus over here, and it is going to send the stimulus over here, right? So here they are going to record the electrical activity. Okay. So what they do, like they check like the electrical activity, how much they provide, okay, and the distance between the electrodes, and the time taken for this impulses to travel from here to here. So what they calculate by this one? if you know what is velocity, they can measure the nerve conduction velocity. Okay, so the most common reason for nerve conduction studies is requested for suspected carpal tunnel syndrome. So that's why I take this photograph. Not like this, like we can check any nerve, but this one is for carpal tunnel syndrome. Okay, so as I told you, the median nerve is entrapped here. So this is like they're running nerve conduction studies for carpal tunnel syndrome. Then you can see over here, this is something called as electromyography. Okay, so what they do now here, see, myo is muscle now. What they do, they put different electrodes, you can see over here, okay, or you can see over here, okay. So both of them, they are same. Either this one, okay, either you can see this one. I will enlarge the photograph for you. So either you can see like in this one, what is he's doing, like he have put the electrodes, right, or you can see the needle electrodes. So surface or needle electrodes like are used, you can say, to detect the muscle action potential. Okay, so they put this thing and they give a stimulation. Okay, so the electrical stimulation, of course, there is an action potential within the nerve which goes and it simulates the muscle. Okay, so then this machine, this record that findings. Okay, so now there is too much details in this one. For example, something called a single fiber electromyography. Okay, and one of the thing, what they do, like when you will study conditions like myasthenia gravis or Eaton Lambert syndrome, what you will find that in myasthenia gravis they keep on giving multiple potentials, and with each successive stimulation the muscle contraction decreases. That is called as a decremental response. So that is a finding in myasthenia gravis. And if with each successive stimulation, if it is increasing, so that is a response what we get in Lambert-Eaton syndrome. Okay, so this is electromyography. Now you can see over here, this is something called as visual evoked response, or you can say potential. Now you can see, like in this photograph, what they are showing you is there is a lady sitting over here, okay, or in this one, like they both are same. Okay, this is the same thing. So you can see, like in this one, this guy is looking something and they have put electrode over here, right, to detect the brain activity. Or in this case, of course, like see, they have connected many of them. So now what they are doing, see, visual. So what they do, like they stimulate the eye, okay, in order to evoke a response within the occipital cortex. Like the occipital lobe is behind where there is visual area. So now see, they put a number of electrodes on the scalp in the occipital area, and now they ask the patient to see this thing. Okay, so whenever the person sees something, the conduction is carried all the way towards the occipital lobe, and here the activity is recorded. Okay, so they check the speed of the response of the nerve and how much height is the waveform. So see, this computer is noticing everything. So of course, like this is the patient and this is the examiner, and they are checking. So this is usually performed again in multiple sclerosis. So like in multiple sclerosis, the wave form is preserved, but there is delay in the you can say the conduction speed because of optic nerve demyelination, right? So this is visual evoked response. And the last one, which is quite famous, and I think all of us, we know what is that, is electroencephalogram. Electroencephalogram or graphy. Okay, so it is basically called as EEG, right? And that's why Americans call ECG as EKG, because they said like it can mix. So what is this? Like you can see in electroencephalography or electroencephalogram, they record electrical activity of the brain using too much scalp electrodes. So now they record the brain activity over several minutes, and the most common use of electroencephalography is to diagnose epilepsy. Okay, that is the most important use of this one. So of course, like in epilepsy, there are seizures and there are different type of seizures, and different type of seizures basically give different type of waveform. Okay, so now uh, nowadays, like in many of the times, like when you have to make the diagnosis, they put these electrodes over the patient for several hours or even several days. Okay, and then they keep on supervising, because though that, like, sophisticated devices, they keep on taking recordings and they keep on recording the things. Okay, so and that is like the way to differentiate between a seizure and a pseudo seizure as well. So uh, I will show you how the things look like and how we get the result. You can see over here. Here the electroencephalogram showing typical brainwave of sleep and wakefulness. So see stage 1 of sleep, um, stage 2 of sleep, stage 3 of sleep. Okay, so see, like in every stage there is a different waveform. Okay, so for example, in epilepsy there is a spike and waveform. Uh, okay, it's not over here. In different conditions, you can say these waveforms are different. Okay, so that's the important thing we can we can do. So simply, this is electroencephalography. Okay, so that's all, guys, for this neurological diagnostics. Okay, I will see you in the next lecture. Thank you for listening.